How's it going, guys? So this is a bit of a challenging question for internal medicine. These types of cardiopulm cues can seem very subjective and not clear-cut, where some of these answers more than one answer might seem correct, but I'll tell you exactly what you need to know for USMLE, not waste our fucking time, all right? So before we get started, please subscribe to my channel. I really appreciate it. Give the video a like, really appreciate it. Find me on Instagram, Mehlman_medical, MEHL_medical. Link is down below. Find me on Telegram. Recently created a Telegram group and channel. Links are down below. Now, let's start the fucking question here, where we've got this 70-year-old dude, 4-month history, shortness of breath, mid-sternal chest pain, sweating. Each episode lasts 2 to 5 minutes and is precipitated by walking upstairs in his home. Symptoms are relieved with rest. This is classic angina pectoris, not complicated, not hard, okay? This is ischemic heart disease due to atherosclerosis of the coronary arteries. He has hypertension managed with lisinopril, so an ACE inhibitor. So hypertension is the most common risk factor in the population for atherosclerosis. Okay, it leads to endothelial damage, increased risk of atheromata. He has smoked 1 pack of cigarettes daily for 50 years. One of cigarettes, so it's a fucking typo. I'm not going to restart the whole clip here. I'll write a comment in the YouTube below. It's like, OMG, 1 pack of cigarettes daily, 50 years, okay? So cigarette smoking is an acceleratory, it's the second most acceleratory risk factor for atherosclerosis. So we talk about which risk factors most hasten the development, most quickly cause atherosclerosis. Number 1 is going to be diabetes mellitus, both type 1 and type 2. Number 2, smoking. But in the population overall, if we pull people off the street, hypertension is most common for causing atherosclerosis. So vitals are within normal limits. Lungs are clear to auscultation. This tells us that we don't have overt left heart failure. Okay, we normally have pulmonary findings, crackles, pulmonary edema, etc. There is no ankle edema. This tells us we do not have overt right heart failure. Okay, so pedal edema, JVD, hepatosplenomegaly, that would be for right heart failure. So left heart failure plus right heart failure is congestive heart failure. This vignette, although yes, he's got cardiac issues, it's not congestive heart failure. Okay, so that makes echo the wrong fucking answer, because echo is what we would do when we want to check ejection fraction in either left heart failure, in either right heart failure, or in congestive heart failure, where it's a combination of the two. Okay, that's when we would do an echo here. Wrong fucking answer. So ambulatory ECG monitoring, also the wrong fucking answer. This is what we would do for atrial fibrillation. So if a patient has a TIA, a stroke, or a retinal artery occlusion and has a normal blood pressure, which would suggest to us that it's not carotid stenosis, because carotid stenosis is due to hypertension. Plaques launch off to the brain. If the patient has normal blood pressure and has a stroke, TIA, or retinal artery occlusion, we're going to do just a normal electrocardiography ECG looking for atrial fibrillation. If that's normal, we're going to do an ambulatory ECG monitor, also known as a Holter monitor, to check for paroxysmal atrial fibrillation. Okay? Wrong fucking answer in this case. Exercise stress test is the correct answer because he has ischemic heart disease, okay? Ischemia. So he's going to do an exercise ECG stress test. That's what we'd want to do first. And we would see not only is he going to get angina, but he's also going to get ST segment changes when he does the ECG exercise stress test, okay? I've seen one NBME question for TCK where they give you an abnormal baseline ECG. So this is a factoid, okay? It's a medicine 301 level factoid, which is in order to do an exercise ECG stress test, you must have a normal baseline ECG. So if they tell you ECG shows, for example, left bundle branch block, which means left ventricular hypertrophy, you would do an exercise echo stress test instead. I've seen both as correct answer as separate answers where exercise echo is correct if you have an abnormal baseline ECG. Okay, you must have a normal baseline ECG to do an exercise ECG stress test. I've also seen pharmacologic stress test as an answer in one patient who just had overt ischemia immediately upon any degree of exercise. Okay, they want dipyridamole thallium for that. So this guy, I mean, he's going to get chest pain within 2 to 5 minutes, but if they told you all he does is get up from a chair and he instantly gets chest pain, you're not going to be able to do an exercise stress test in him, okay? So you do a pharmacologic stress test, dipyridamole thallium. Or if a patient's going to be undergoing surgery, such as a AAA repair, I've seen pharmacologic stress tests, okay? They can also call it cardiac scintigraphic assay or cardiac scintigraphy, myocardial perfusion scan. Measurement of ABIs, ankle brachial indices, wrong fucking answer, but extremely high yield for USMLE for the first step in diagnosis for peripheral arterial disease, okay? Peripheral vascular disease. So if a patient has intermittent claudication, you're going to do ABIs, which is comparing the blood pressure in the ankle to the blood pressure in the arm. And if the ratio is below 0.9, that is consistent with peripheral arterial disease, okay? And then you're going to recommend a walking program as the first step in treatment. That's what they want. Cilostazol, wrong fucking answer. Okay, phosphodiesterase inhibitor that can be used for intermittent claudication. Wrong answer on USMLE. They love throwing that in there. You're going to do an exercise / walking program. Measurement of serum troponin, wrong answer. I mean, this is for acute MI. Whilst, yes, he has ischemic heart disease, he doesn't have an acute MI here. Okay, so obviously for an MI, you do a regular ECG anyway, and you would check troponins. But checking troponins in this case is not going to confirm his diagnosis. We need to confirm ischemic heart disease. Okay, so we're going to do an exercise stress test. You know the deal. I'm going to continue making more content. If you like my stuff, subscribe to my channel. I appreciate your time. That's it.